Hello, this is a presentation that was made by Mrs. Linda Bowers, Branch ISD school nurse, and it's on anaphylaxis treatment and procedure protocols. Recently, in December 2013, the Michigan school laws were added in on the EpiPen school laws. House Bill 4353 indicated 2 epinephrine auto-injectors per public school were to be placed. A minimum of 2 trained staff. Most all of our teachers were trained, and most of this responsibility will fall on the MERT team. But everyone should know about these laws. The House Bill 4352 gave legal immunity to school districts, boards, officials, staff, and pharmacists for implementing this law. And basically, it allows once a student has been determined that they're having anaphylaxis condition, that we use epinephrine pens, the EpiPens, on them to save their life. Anaphylaxis is a severe, life-threatening, whole-body allergic reaction to a chemical that has become an allergen, such as food, insect sting, medication, latex, or possibly something unknown. After being exposed to a substance such as one of those things, the person's immune system becomes sensitized to it. On a later exposure to that allergen, an allergic reaction may occur. This reaction happens quickly after the exposure is severe, and it involves one or more body systems. Possible allergens are pictured here for us, but there could be numerous others too, including medications. And this basically what happens when a severe allergic reaction takes place, and these histamines are released. That creates the problem of the anaphylaxis. The irritant substance causes runny nose, but with anaphylaxis it's drastic. There's swollen, trouble breathing, and there's other conditions that should be noted. Here are some of the common signs and symptoms of anaphylaxis. The skin, hives, itching, flushing, mucosal tissues, pruritus, the sinus drainage, swelling of lips, tongue, and the uvula palate is swollen. That's in the back of the throat, hanging down. It gets swollen also. The central nervous system, some of the reactions: uneasiness, throbbing headache, dizziness, confusion, tunnel vision. Cardiovascular system, chest pain, hypotension, tachycardia, weak pulse, dizziness, fainting, and then 30 to 45% of reactions are nausea, cramping, abdominal pain, vomiting, diarrhea. But 70% of reactions of anaphylaxis is larynx, pruritus, and tightness in the throat, dysphonia, and hoarseness. In the lungs, dyspnea, chest tightness, wheezing, and bronchospasms. So any of these, a combination of these things would so indicate anaphylaxis is occurring. Here are some images of anaphylaxis, swelling of the hives associated with difficulty in breathing. Notice the swollen lips, the red spots. Here, the hives that are broken out on the individual. Estimated impact of food allergies in the United States. There's been an increase in this since 1990s. Every 3 minutes, a person is treated in the emergency room. 2,000 hospitalizations per year, 150 deaths per year across the United States, and 1 in every 13 children in the U.S., or roughly 2 in every classroom, have food allergies, and the food allergies can become severe. Treatment of anaphylaxis: there's no cure. No preventive treatments to protect against life-threatening reactions. A strict avoidance of allergens are important for these individuals. Use of emergency medication when a reaction occurs to prevent fatal results of exposure. The problem is that we don't know when any person may have anaphylaxis, depending on what they are allergic to. The EpiPen administration. During the training at the staff meeting, we did have practice auto-injectors, EpiPen we practice this with, and the directions on the EpiPen are self-explanatory, but basically you remove the auto-injector from the clear carrier tube, flip open the yellow cap of your EpiPen or the green cap of your EpiPen Junior auto-injector carrier tube, tip and slide the auto-injector out of the carrier tube. Grasp the auto-injector in your fist with the orange tip pointing downward. And you grab it not with your thumb on top of it, but just clasping your grip around it. With your other hand, remove the blue safety release by the pulling straight up without bending or twisting it. So you pull that off. Note the needle comes out of the orange tip at the base. Never put your thumb, fingers, or hand over the orange tip. Then the injection. Swing and firmly push. So you swing out with your hand away from your thigh, or from the thigh area. Push, and you firmly push the orange tip against the outer thigh until it clicks, and you hold it there. You keep the auto-injector firmly pushed against the thigh at a 90-degree perpendicular angle to the thigh. Hold firmly against the thigh for approximately 10 seconds to deliver the drug. The injection is now complete. Remove the auto-injector from the thigh. The orange tip will extend to cover the needle, so you won't see the needle, but the medicine has been injected. Massage the injection area for 10 seconds, and you also call 911. In the injector, the EpiPen box, along with the first aid kits and also the defibrillator in the hallway, there is a form to fill out for this process of whenever you work with a MERT situation. But you call 911, you may need further medical attention. You listen to the 911 and they'll instruct what to do. You may need a second EpiPen or EpiPen Junior auto-injector should symptoms persist or recur. We have EpiPen Juniors, and 2 EpiPen Juniors would be equal to 1 adult injection. The second dose may be given 5 to 15 minutes following the first, and it would be on the advisement probably of the 911 responders. So we have the anaphylaxis procedure that we see here. We have an action plan. There's exposure to some type of allergen that creates the anaphylaxis, life-threatening reaction, wheezing, shortness of breath, swelling of the tongue, face, the lips. So you've got multiple body functions that are telling you that there's a severe allergic reaction. Initiate medical emergency response. Contact the MERT team. The first responder will notify the office describing the following: allergic reaction, location, identify victim, request calls to the following MERT in need of the EpiPen. 911 is called, the parent is called, the principal is called, and here we see the secretary calling, making the phone calls, the MERT second responder taking the EpiPen to the location, remove the safety cap, administer the end of the outer thigh near and hear the click sound, hold it for 10 seconds, massage the area, note the time giving on the form. The third responder, remove other students, obtain and provide ice pack if needed for the insect bite, or depending if there was a place where the allergy was severe. And then there's additional things that can be done. Remove the stinger. If it's an insect bite, apply ice, have the victim lie down. Quite often you'll treat them for like shock symptoms. Monitor their airway and breathing. If symptoms continue to reoccur, you may give the second dose of the EpiPen Junior. Wait 5 to 15 minutes. You give the report to the EMS as they arrive. What was the trigger if known? What presenting the symptoms were and what time the EpiPen given. You document the incident. We also have a medical emergency response worksheet. And these worksheets are found in the EpiPen yellow box in our health room. They're found in the red fanny pack first aid kits. They're also found in the defibrillator at the end of the hallway by the gym by the library. And these can be filled out by second and third responders appropriately so that we have a record of what is happening. Things to consider. Location of the EpiPen, they're found in the health room. Regular school days, outdoor activities, field day, pumpkin runs, or various activities such as the Rhine Field Day. We will want to put one of the EpiPens in a red fanny pack first aid kit, also for field trips or special sporting events. All staff need to know where the key is kept. Now ours will not be locked. It is in the health room but on a top shelf in the yellow box. It's still in a safe and accessible place for staff members. Who's going to be responsible for checking expiration date and color of the epinephrine? That'd be the office personnel, the secretary or the principal, and they should be checked also along with the pads, the adhesive pads that are used with the electronic fibrillator. Who is going to be responsible for ordering new epinephrine when expired or one dose has been used? And that would also be from the school office. Questions? Take the questions to the school principal or the school secretary. And if we cannot answer them, then we will contact Branch ISD nurse for additional assistance.